What are the solutions? Tonight, I will share some with you. Shall I do that? What the UNC government will do. A UNC-led government will work to ensure that all receive proper health care. I have a list here, and these are only some of them. Again, I thank the doctors and others who have shared with me. I think we have over 50 plans here to deal with healthcare and the healthcare sector. So if you give me a moment, I think it's about 50. I'll go through that with patience and kindness. It's up on the screen too, and you can take a look. So about 50 plans, solutions to deal with healthcare in our country. 1, a UNC-led government will improve healthcare in the following ways. 1, review the Children's Life Fund legislation to enable more applicants with diseases not presently included in the fund to access that healthcare facility, Children's Life Fund. 2, ensure the Couva Children's Hospital is fully equipped, staffed, and operational. 3, install a centrally specialized burns unit close to the Point Lisa's industrial complex. This unit can be part of the Couva Children's Hospital and training facility. 4, purchase and maintain modern equipment at all medical facilities. This will also include having qualified and trained staff to operate the equipment. 5, fix the supply chain issues to prevent the shortage of drugs, equipment, and supplies that now hinder the work of doctors and nurses at many of our healthcare facilities. Fix the chain supply issues to prevent shortage of drugs, equipment, and supplies that now hinder the work of doctors and nurses at many, many healthcare facilities. 6, establish guaranteed maximum waiting times for clinic appointments, diagnostic tests, and surgical procedures. 7, immediately treat the backlog of patients awaiting critical diagnostic tests and surgeries, including cataract and joint replacement surgery. 8, create a national stroke rehab center. Create a national stroke rehab center. 9, treat the chronic non-communicable disease burden promptly and innovatively, including reintroducing extended hours of opening at health centers, as well as school and home visits within communities. If you're as young as I am, you may remember in school, doctors used to come and visit us in school. Anybody young like me could remember? We have to reintroduce these visits, school and home visits. Yes? And dental as well, yes. 10, settle negotiations in the health sector. Offer proper, better terms and conditions for all doctors, nurses, and other staff in the healthcare system. 11, introduce legislation to create a unique medical malpractice court and special investigative unit aided by experts to handle suspected medical malpractice cases. 12, the great majority of medical malpractice cases are civil matters. We will also establish a no-fault compensation fund so that affected citizens can receive relief even outside of the courtroom. 13, conduct a skills audit within the public healthcare system to train qualified staff in highly demanded areas of specialization. 14, provide opportunities and funding for doctors and nurses to specialize in particular fields. 15, do a full review of the management of the COVID-19 pandemic in TNT for clinical management and economic impact. 16, revise the patient's charter to give patients a greater voice when it comes to public health services. 17. Implement a national health card for all resident citizens so that a patient's records can be accessed at any public and or private health facility. So you have your national health card, anywhere you go, you stick in the card and you'll have a full record of your medical history. So then you can be treated properly. This will save time and allow the healthcare provider to access information at their fingertips. This means faster delivery of health services and will make the issue of lost files a thing of the past. Lost files. I don't know how these doctors have lost these files, but the national lawyers do, okay. Yeah, the AG lost a file up there. So the National Health Card will be a great innovation to improve in healthcare. 18, we will also implement data protection systems to back up these electronic medical records safely and securely. 19, review the entire IT system at all RHAs and procure the latest IT technology and systems for the RHAs to mitigate against cyber attacks and hacking. 20, conduct an audit of the number and qualifications of the many foreigners working in our health sector while our citizens remain jobless at home. 21, employ local doctors. Increase the number of doctors in the public health system to achieve the required complement at all public hospitals and health centers, and thus increase the number of doctors to the number of patients. That ratio has to be fixed. 22, employ local nurses, increasing the number of nurses in the healthcare system by focusing on training and certification of nursing programs and the availability of jobs within our public health sector, and so increase the number of nurses, again, nurses-patient ratio. Now, I remember, Khadija could remind us if it's still open, we had opened a training facility. It was in Tacarigua. El Dorado. Training facility. It closed down. The PNM closed it down. I don't know what these PNM people don't like to see people learn anything. A training facility at El Dorado to train nurses and other medical personnel in all fields. And they were being trained because we had said at the Cuba Children's Hospital, 2,000 jobs would have been created. Dr. Bodis now reminded 2,500 jobs would have been created. So not only would we have got better health care, we'd have been creating jobs for the people of Trinidad and Tobago, taking care of the people of Trinidad and Tobago, and we would have been able to earn foreign exchange because the rest of the Caribbean, we would have a #1 health facility there, and they will pay to come here. Pay to come here. The same way they pay to come to UE, they would pay to come to that state-of-the-art hospital. Now they pay to go Miami, some go to Venezuela. Well, I don't think they go in Venezuela anymore, but to go to Colombia and other places. Yes, medical tourism, that's the word, medical tourism. That was the plan. 23, employ local technicians. Increase the number of cardiovascular, radiographic, and other specialist medical technicians. Again, more job and better healthcare. 24, focus on decreasing wait times for clinic appointments and surgeries by targeting and increasing nursing staff and medical doctors to these facilities or departments to reduce the workload on the existing staff. 25, train primary care doctors. Increase the number of primary care doctors will decrease non-communicable diseases such as heart disease, hypertension, diabetes, chronic kidney disease, and obesity. 26, equipment audit. All diagnostic and radiographic equipment will be audited to determine any deficiencies with a mandate to fully equip medical professionals with the equipment they need. 27, I know this is very close to the heart of Dr. Bodo. Build cath labs build cath labs. Complete construction, equipping, and operationalizing of the cath labs at all major hospitals. So you get a little heart, something, Sanford is not equipped, They're not equipped, they don't have a cath lab. You're going in there, never to come back out walking. You're coming out on a stretcher. And you're going into the morgue. Build these cath labs at San Fernando General Hospital, Arima Hospital, the Grande Hospital. The Scarborough Hospital has a cath lab, but there is no attending interventional cardiologist. So when you have the lab, you don't have the doctor. And when you have the doctors, you don't have the lab. Totally wrong side government. This would enable cardiac stenting on a 24-hour basis within minutes of arrival at the hospital. If you have that cath lab, within minutes you go in there, diagnose, and they can do stenting, which will make you stay alive, will extend your life. Enabling of a nationwide 90-minute policy of heart attack to stent. Within 90 minutes, we tell you, we can do it. You must put us back in government and we will do it. Heart attack to stent, a 90-minute period if we have fully equipped cath labs and doctors. 28, this one again is so many people it affects. Dialysis clinic. Dialysis. Complete construction, equipping, and operationalizing of dialysis clinics at all the major hospitals with relevant staff to enable dialysis on a 24-hour basis. So you reduce the state's bill to the external patient program by at least 100 per year. Right now we have to go and pay, the government is paying $100 million a year to go in a private place. And when you check out who owns some of those privates, that'll be another story. Who owns them? $100 million a year, which we can now pump into our own state institutions, hospitals, to take care of all those people with kidney problems, to have dialysis at our hospitals. That way, as I say, we can reduce the bill of $100 million per year. We can allow only emergency dialysis to be paid for by the private providers. So we bring everybody in, but if there's an emergency, you can still use the external patient program, okay? But let's equip our hospitals, have these dialysis clinics. 29, ambulance service. Last time I remember, it was when Mr. Pandey was in government, that we set up ambulance with Dr. Hamza Rafiq, yes, those ambulances. Since then, the PNM has done nothing to improve it. Ambulance service. We will expand the ambulance service to rural areas in Central and South Trinidad and East as well, with the creation of a Central and Southern hub for cleaning and re-outfitting these ambulances. 30, National Lab Center. This state-of-the-art lab adjacent to the Coover Hospital and outfitted with equipment and staff to enable the quickest turnover in testing, a National Lab Center for turnover all your testings, to do it there at a central point. 31, National Cardiac Center, a state-of-the-art cardiology center adjacent to the Coover Hospital, operating with 2 operating theaters, 1 ICU, 1 CCU, and a cath lab to allow bypass surgeries to be done. This would significantly reduce the bypass backlog. Patients currently have to wait at least 12 to 18 months for bypass surgery. By that time, they bypass you, you're dead. 12 to 18 months, yes. This can be remedied when we set up the National Cardiac Center. Right down Coover, we have the land. The state has the land. 32, strategic partnerships with international health educators for internal medicine, for cardiology, and nephrology. Doc, what is nephrology? Kidneys. Deal with your kidney. So for your heart, cardiology, and nephrology to deal with kidneys. Strategic partnerships, we have had some of those before. The Chinese have been very helpful to us in the past. At the San Fernando General Hospital, they were, yes, they came, the neurosurgeon, Chinese team had come down during my term in government and gave the benefit of their expertise. So we can do strategic partnerships with others. 33. I know you will like this one, Sandra. And I know Brenda will like it even more. CDAP. CDAP. Because Brenda will send me 50 text messages during the day about people suffering and they can't get the CDAP medication. True or not true? It's true. All the counselors here know it. CDAP. The PNM has killed the CPAP program. We will review and update CDAP. Review and update CDAP. Streamlining medication and increasing service to rural communities. Newer drugs that are very effective in hypertension and diabetic treatment should be now included on the CDAP list. New medications, I mean, technology is ever evolving, but we are living in the Stone Age, in the age of the dinosaurs, when the technology has moved so rapidly. So newer medications should be considered to be added to the CDAP list. 34, childhood obesity. You know what I mean? Childhood fat. In simple language, childhood obesity. We shall propose legislation for front of package warning labeling to be put on retail food products to warn consumers of high sugar, high sodium, and high fat items. Put it on the label. So as a parent, when you go to buy, you can make a decision. You have a choice. It is your lifestyle. It is your choice. But you will at least make a knowledgeable decision. Put it on the package. This will intensify the existing awareness programs for combating childhood obesity and expand their reach. 35, implement a modern prenatal, maternal, baby, and early childhood care strategy. The hospital in Cuba was part of that. Modern prenatal, maternal, baby, and early childhood care strategy. By the way, Doc, whatever became of those 18 babies who died? What has happened? A committee set up again? And nothing. Those 18, you know, in any other country, that happened, you know what have happened? The minister would be gone the very day. 18 babies, man, died in it. Yes, I would have fired him. I would have fired that minister for sure. Some of them sitting here know who got fired already. I was never afraid, and some of them hate me still, not true, Tip? I was never afraid when a minister did not perform, or minister did things that were not acceptable. I was never afraid. I fired them. I did it once, I'll do it again if I have to. I will do it. I will do it. There must be accountability and transparency. 36, expanding access to immunization. What that means? Vaccines. Access to getting the vaccines. 37, we'll implement a multi-pronged strategy to deal with reproductive issues and to empower women to seek good health during pregnancy. 38, maternal and child health policy and standard operating procedures for obstetrics and midwifery will be updated and implemented. 39, antenatal and postnatal care services will be improved by purchasing additional equipment needed to track the health of mothers-to-be and their babies. Everybody who had a baby, everybody expecting a baby, the UNC will reintroduce the baby grant. 41. An emergency response plan will be developed to cover all possible medical crises ranging from natural hazards and oil spills to infectious diseases. That includes the dengue. How many told me 16 now dead from dengue. 42. The Minister of Health will make an interministerial arrangement with the Ministry of Housing and Urban Development and the Ministry of Environment and Water Resources to address the effects of climate change on human health. 43, we'll initiate a national awareness campaign on mental health. Mental health. We don't pay enough attention. We will initiate a national awareness campaign on mental health. 44, public-private partnerships will be formed to widen the Ministry of Health's reach in mental health promotion. Some persons desperately need mental health help, but they don't even know it, some of them. 40. Somebody said they said they're talking about some role. They told me those things. All right, okay. But you all know who needs help. Moving along, 45, we'll formalize a draft National Comprehensive Mental Health Implementation Plan. 46, mental health services will be integrated into all routine health service delivery systems. 47, we will increase the number of trained staff at the Ministry of Health Research Unit so that more health research can be accomplished and timely data can be provided. 48, formulate a healthcare financing policy, including introducing and implementing a comprehensive national health insurance system. A comprehensive national health insurance system, and create mechanisms for sustainable financing. 49, the Ministry of Health will collaborate with the Ministry of Education, Tertiary Education and Skills Training, and research institutions focused on the health sector to develop a comprehensive plan for TNT's health, wellness, and preventive medicine. 50, and this is 50, and there are many more I share with you tonight, 50 of our plans, our solutions to improve healthcare in Trinidad and Tobago. 50, commit to the full refurbishment and proper resourcing of the Insect Vector Control Division of the Ministry of Health. I could rest it there now on healthcare. So we have the plans, we have the policies, we have the will, we have the vision, and we have a mission to rescue and rebuild Trinidad and Tobago.